The generic formulations are required to be similar to the reference formulation, reference listed drug, or the reference standard formulations. The generic formulations should demonstrate the similar safety and efficacy to the reference formulation. Also, the quality of the generic formulations is required to be similar to the reference formulations. And in this, size and shape of the generic formulations like tablets and capsules are also considered. Size and shape of the generic formulations are critical quality attributes. Also, size and shape of the formulations affects the patient compliance, adherence to the therapy treatment, and it also affects the patients which are in the category of geriatrics and pediatrics. So, size and shape of the generic formulations are critical. US FDA has given specific guideline for the size and shape considerations for the generic tablets and capsules. The size and shape of the generic formulations are required to be in line or similar to the reference listed drug, that is RLD. And FDA has given information regarding tablet size and the capsule size. Also, US FDA has given specific requirements for the generic formulations. If the RLD is 17 mm in the largest dimension, then generic product should not be more than 20% of the RLD dimension in any dimension, but still must stay under 17 mm. For example, if the RLD is 16 mm, then if you consider 20% of the 16 mm, and if it is going above 17 mm, then you cannot go beyond that. That means 17 mm is the cut off. For example, if the RLD is 10 mm or 12 mm and you calculate 20% larger, and you can take that larger dimension for your generic tablet development. But if it is going beyond 17 mm for certain RLD dimension like 16 mm or 16.5 mm, then there is no margin of 20%, but it will be 17 mm only. Then it should not be more than 40% larger in the volume than the RLD. So if you are falling into the criteria of 20% larger dimension and you are not falling into the volume criteria of 40%, then you cannot go beyond that. Then if RLD is 17 mm or above 17 mm, then generic formulation must not exceed RLD's dimension or volume. That means if RLD is 17 mm, you need to make the generic formulation of 17 mm only, and it will not be larger than the 17 mm. Also, it should be in line to the volume of tablet of RLD. Then maximum limit. The largest dimension of tablets capsules must not exceed 22 mm. That is the length. Tablet length should not be more than 22 mm. Also, the capsule length should not be more than 22 mm. And for capsules, the size should not exceed more than size 00. So for tablets, consider the volume criteria and larger dimension criteria for the RLDs which are less than 17 mm. If RLD is more than 17 mm or it is 17 mm, then you should be in line to the RLD only, and the maximum dimension of the tablet, that is length, should not exceed 22 mm. Capsule size should not exceed size 00. Capsule size adjustment can be done if RLD capsule size is size 3 or smaller. You can increase the capsule size by 1. If capsule size is 1, if capsule size is 2, you can go to the larger size. If the RLD capsule is size 2 or larger, then any increase in that size will require scientific justification. So then practical importance. So these size and shape guidelines are mainly for ensuring the patient acceptability, swallowability, and to demonstrate the therapeutic equivalence. These size and shape guideline considerations are very important for the ANDA and for 505(b)(2) submissions. This was a short video for size and shape requirements for the generic tablets and capsules, mainly for the US market. As per IMA, there are certain requirements, and if you are working onto a global formulation development, you should always consider the requirement of size and shape for the generic tablets and capsules. Also, try to have similar size and shape like RLD. Thank you for watching the video.